So are you dealing with trouble swallowing, pain right here in the chest, persistent heartburn? So you may be suffering from something more than just indigestion. Howdy y'all, I'm Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic. And in today's video, I'm going to discuss a condition which you actually may not be aware of you could be having called esophagitis. This may be the reason why you're having so many issues. In this video, we'll discuss exactly what is esophagitis. We'll discuss the different types of esophagitis. We'll discuss the symptoms of esophagitis. We'll discuss the causes and the risk factors. We'll discuss the diagnosis of esophagitis. We'll discuss the treatment options that I recommend as a GI doctor to get your esophagitis taken care of. And towards the end, I'll explain the complications of this condition and what you can do to prevent it. So we'll do a deep dive in everything you need to go when it comes to your esophagitis. Guys, let's talk about treatment. Howdy y'all, I'm Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic. I have over 10 years treating thousands of patients with esophageal issues. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And come see us up at Gastro. We can find out exactly what's going on to get you taken care of. What exactly is esophagitis? So esophagus is this food pipe that goes down from your mouth up into your esophagus. It's the connection between your mouth and what you eat and your digestion, the esophagus. And itis means inflammation. So esophagitis means inflammation of the esophagus. There's some irritation that's going on in which the cells of the esophagus are changing from normal cells to inflamed cells, as well as some sort of irritant or inflammation going on inside the esophagus. This inflammation can cause a range of symptoms depending on the location and the severity. It can have its own complications, which we'll talk about later on in this video. So what are the different types of esophagitis? There are different types of esophagitis depending on what we see whenever we take a look. The most common one is reflux esophagitis. As you can hear, this is due to chronic acid reflux. Reflux over time can cause irritation to go inside the esophagus. Your esophagus does not like to be irritated. It doesn't want it, and it doesn't like acid in there. And so it does what it can to hopefully allow the acid to go down into the stomach by opening up the lower esophageal sphincter. However, if you have too much acid going up in the esophagus, this will cause irritation and inflammation to occur. This is called reflux esophagitis. This is exactly what it says. When acid backflows from the stomach into the esophagus to cause irritation, it stays there over time, chronically, then it can cause inflammation to occur. The second type of esophagitis is called eosinophilic esophagitis. And this is a little bit different. This is a chronic allergic condition due to a combination of acid reflux, environmental allergies, and foods that can cause eosinophils or allergy cells to infiltrate the esophagus to cause narrowings, strictures to occur, and this can commonly cause a problem called dysphagia or trouble swallowing. And the third type is infectious esophagitis. Now, there are three common infections that can cause inflammation. One is Candida, number two is herpes, number three is cytomegalovirus or CMV. So Candida is exactly what it sounds like. It's a bacterial infection inside the esophagus, very similar to a Candida infection in your butt. But you're not having butt issues in your esophagus, but it can cause irritation to occur. Then the most common trigger for Candida esophagitis is having these inhalers that you take for either asthma or COPD, or having oral steroids or inhaled steroids. Now you have the other types of infections. HSV stands for herpes simplex virus, or CMV, cytomegalovirus. Now these viruses commonly can cause inflammation and ulceration inside the esophagus. And both these two viruses are typically seen in the scenario of immunocompromised individuals. So the common scenario that I see is that I have somebody who has a bone marrow transplant or chemotherapy come to see me with severe pain in the esophagus. They have trouble swallowing, it hurts, it doesn't feel very, very good. And so in my thought, I'm thinking, all right, this individual is going to have some sort of infectious etiology, most commonly due to either HSV or CMV, which you commonly see in immunocompromised individuals. And then whenever I take a look with a scope, I can see if that's the case and determine that's the treatment and the diagnosis for this individual. Now, the fourth type of esophagitis is drug-induced esophagitis. Yes, drugs can cause inflammation in the esophagus. There are certain drugs that are notorious to be big old pills like horse pills that can get stuck in that esophagus to cause inflammation and irritation to occur. These are pills like doxycycline, bisphosphonates, potassium pills. They become stuck in the esophagus because they're so big, they can irritate the esophagus and cause inflammation to occur. So what are the symptoms of esophagitis? How do you know? Well, there are a couple of cardinal symptoms you should be aware of. The first one is severe pain. Epigastric pain in this area is typically a symptom of esophagitis. Your esophagus is right here, and if it gets inflamed and irritated, you're gonna feel the pain right here. Number two is trouble swallowing. Now, if you have trouble swallowing food or water gets stuck, or even pills, that could be a sign of inflammation going on that can cause a narrowing to occur in that esophagus to cause things to get stuck. Number 3 is really bad acid reflux or heartburn. That reflux symptom that you're feeling just all up into your chest right here, this can also be a sign of esophagitis. Feel like you're having a heart attack, chest pain right here that's non-cardiac, absolutely can be a symptom of esophagitis. I've had plenty of patients who see me, hey, Dr. Islam, I had this pain right here. I felt like I was having a heart attack. You know what I tell them? Go see your cardiologist. Make sure you didn't have a heart attack. Then when we cleared you, come see me. We'll find out what's going on. So if you're having chest pain, don't ignore it. Don't say, hey, I saw this guy on YouTube. He said it's the esophagus, not a big deal. No, no, no. Make sure you see your cardiologist or your doctor to make sure you can rule out heart issues. And if it's not the heart, come see me. We'll find out what's going on. Other symptoms can include nausea, poor appetite, coughing, asthma, sore throat. These are other symptoms of esophagitis. They're not as common, but it can be the case. So why do you even have esophagitis? What is going on? What are the risk factors? Well, the first factor is chronic acid reflux. Like I mentioned before, acid does not interact well with the esophagus. Your esophagus is not like acid. And so if you have acid reflux, you have acid constantly going up into the esophagus, that can cause inflammation to occur to cause your esophagus to be irritated and inflamed. Number 2, medications. As I mentioned before, certain medications are notorious to cause pill esophagitis. In fact, I warn patients, hey, if you're going to be on this big old horse pill, just be careful. You drink a lot of water. You sit upright whenever you take the pill and make sure it doesn't get stuck. Number 3, infections, particularly in a weakened immune system, bone marrow transplant, chemotherapy, or if you take an oral inhaler or an oral steroid for a COPD or asthma. Number 4, allergies. So if you suffer from seasonal allergies or dry skin and reflux, that's the triad of EOE or eosinophilic esophagitis. Number 5, lifestyle factors. Smoking will make it more likely for you to have esophagitis. Alcohol consumption will also irritate the esophagus. That plus smoking is almost a quadruple whammy in your esophagus. Dietary factors can also contribute to what's going on. So high fatty foods, greasy foods, foods that are not good for you can cause irritation to occur as well. Next is obesity. Obesity not only is a risk factor because of the pressure you put on your esophagus, it also is a risk factor for acid reflux, which also will make it more difficult for the acid to leave the esophagus to go into the stomach. Then lastly, a hiatal hernia. Yes, a hernia can make it more likely for you to develop esophagitis. So a hernia is when part of the stomach goes above where it should be, and when it does that, it traps acid up in this area. And that acid over time will cause inflammation and irritation to occur. But a hernia will also make it more likely for the valve between the esophagus and stomach to be open longer and more often, which will also make reflux symptoms worse, which will also make your esophagitis worse as well. So how exactly do I diagnose somebody with esophagitis? Well, the first thing, surprisingly, I talk to you. Yes, a good history and physical is going to give me a better idea of what's going on. So if you're telling me, hey, I got pain right here, I have trouble swallowing, I have bad heartburn, I have a history of a hernia, I smoke and I drink alcohol, and I have allergies, oh my gosh, that's like a terrible combination for your esophagitis. So a history and physical is the first thing that I do. The second thing I do is I take a look. I do what's called an upper endoscopy or an EGD, where I take a look with a small camera to see exactly what is going on. So I can check for inflammation, I can check for hernias, I can check for damage, I can check for the degree of inflammation, so we can determine the next steps based on that. Then number 3, sometimes we'll do pH monitoring. pH monitoring is a way for me to objectively see how much acid is going up. And so with that, I can see exactly the amount of acid that's going up. Is it normal? Is it abnormal? And I can correlate that to those symptoms you're describing as well. So let's say you've been diagnosed with esophagitis. What do? Well, here are my tips that I recommend. So the first line treatment that we recommend is for you to be on an acid reducing medication, a PPI. So let me stress this. If you have some sort of esophagitis, whether it's reflux esophagitis, pill esophagitis, eosinophilic esophagitis, this means treatment is with a PPI. It's not with an H2 antagonist. It's not with an antacid, though they can help, but the primary treatment is with a PPI, and these actually do work. And studies have suggested that being on a PPI for at least 8 weeks can help decrease the inflammation of the esophagus, has the best effect when it comes to controlling reflux and esophagitis symptoms. Better than antacids and better than an H2 antagonist. Number 2 are dietary changes. You are what you eat, and if you eat like crap, you're gonna feel like crap. So try to eliminate the foods that we know can make reflux symptoms worse. This is not universal, not for everyone, but kind of be aware of this. Spicy foods in some individual can make reflux symptoms worse. Tomato-based foods, chocolate-based foods, mint, sodas, carbonated drinks. I know the list goes on about things that we love, but like I mentioned before, not everyone needs to eliminate these triggers. Use your body as the best guide. Add in more fiber. Studies have suggested adding in more fiber when it comes to reflux symptoms can actually decrease your risk factor for developing esophagitis and inflammation in that area. Other lifestyle changes include losing weight. By far, the most effective thing you can do to help naturally control your esophagitis is to lose weight. Even a little bit of weight will dramatically make a difference in terms of how your reflux symptoms are, the complications from that, and whether you can be treated naturally or not. And so weight loss by far is the most effective option. There are other lifestyle recommendations, including making sure you don't eat late at night, sleeping on your left side, adding more plants and vegetables. These work as well. Number 3, lifestyle changes. So I mentioned some of these, but sleeping on your left side actually does have evidence that it can work. When you sleep on your left side, you actually change the angle between your esophagus and stomach to make it more difficult for acid to go up into the esophagus to cause irritation to occur. Making sure you don't have a late night meal, so waiting at least 3 hours before you lay down can help out. Elevating the head of the bed, this can really help out when it comes to nighttime reflux. Quitting smoking. Smoking will do terrible things for your gut, but not only that, it weakens the peristalsis going on, which makes it more likely for acid to stay in the esophagus, and actually can cause that lower esophageal sphincter to be open longer and more often, to causing worsening acid reflux symptoms. Eating smaller frequent meals throughout the day. This will also make it more likely for you to digest easier and to control your acid reflux symptoms. Number 4, surgery. For some individuals, their inflammation is so bad that they actually need surgical treatment to get them taken care of. Or you have a large hiatal hernia that we know is the trigger when it comes to your esophagitis, and by fixing the hernia, we can control your symptoms as well. All right, what's the big deal? Who gives a flip that you have esophagitis? Well, let me tell you the complications that can occur from this. Number 1 are strictures. Strictures are narrowing in the esophagus that commonly can cause trouble swallowing. So if you have a stricture, that stricture over time will become more narrowed and more narrowed and more narrowed to the point where you may not be able to swallow anything at all. And so if you don't get your inflammation taken care of, that trouble swallowing, that narrowing of the esophagus is going to make it more likely for you to develop worsening swallowing issues. Number 2, Barrett's esophagus. So Barrett's esophagus is a precancerous lesion of the esophagus that over time can cause esophageal cancer. And one of the biggest risk factors for that is chronic inflammation from esophagitis. So you don't want cancer, I don't want cancer, and this is why we want to try and control esophagitis as much as we can. Number 3, esophageal ulcers. Inflammation in the esophagus over time will lead to ulceration of the esophagus or ulcers. And these are open sores in the esophagus and cause trouble swallowing, bleeding, pain. It is not fun. And then lastly, probably most importantly, I mentioned before, esophageal cancer. Esophagitis is a direct risk factor to developing esophageal cancer. And those individuals in which we cannot control their esophagitis, they have a substantial risk of developing cancer of that esophagus. So now that I freaked you out about esophagitis, what can you do today to make sure you don't get it? Here are my tips. Tip number 1, find a way to manage your GERD, whether it's medical therapy, surgical therapy, lifestyle changes, dietary changes, or all of the above. Control your GERD. Number 2, avoid the trigger foods. Know what your particular trigger foods are when it comes to worsening reflux and esophagitis symptoms. Number 3, make sure you take your medications properly, especially the big pills. Take them sitting up with a lot of water. Don't allow them to get stuck. Number 4, quit smoking and eliminate alcohol. All right, if you can't eliminate alcohol, at least minimize it, but for sure you need to quit smoking. And then lastly, maintain a healthy weight. Obesity is a risk factor for esophagitis, it's a risk factor for GERD, it's a risk factor for Barrett's esophagus, and it's a risk factor for cancer of the esophagus as well. So lose weight and maintain a healthy weight. All right, guys, this is everything you need to know when it comes to esophagitis. So I hope this answered your questions about this topic. If you have a question about esophagitis, comment down below. I would love to hear what you guys have to say. Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, come see us at Lubbock Gastro. We can find out exactly what's going on and hopefully get you taken care of. Thank you for watching and tune in for the next video.